Electronic fetal monitor mobile devices, when time and interpretation is of the essence. Innovation of technology utilized in labor and delivery is always growing. This presentation will focus on how the nurse can use her hospital-issued mobile device to record and send information and to call for emergency help. The idea of an all-in-one piece of equipment was developed when I realized how differently nurses, midwives, and obstetricians interpret fetal heart rate tracings. The equipment we currently use are the electronic fetal monitor, or EFM, which is in the upper left-hand corner, a separate handheld Doppler, which is in the upper right-hand corner, and our hospital-issued mobile phone, which is used to communicate the provider or charge nurse. The nurse has to communicate the interpretation of the EFM to the provider over the phone. Sometimes the fetal monitor heart rate is interpreted differently between nurses and providers, so this can sometimes be a problem. When calling a code, the phone needs to be unlocked by using two buttons. You have to scroll to get to the code screen, then you have to scroll through the codes to select the right one, and then enter the room number. The nurse is doing this while at the same time usually attending to the patient and the fetus. The National Institute for Child Health and Human Development, or NICHD, has categorized fetal heart rate tracings. Despite these categories, interpretation can be difficult. As you can see in this slide, there are three distinct categories for fetal heart rate interpretation, and yet sometimes while looking at the fetal heart rate strip, these are not always clear. At EFM Mobile Devices, we have created a mobile phone that is the ultimate in efficiency and safety. Included in the phone are the NICHD guidelines for fetal heart rate interpretation. This means that as a registered nurse at the bedside, you can communicate with the obstetrician by referring to the provider the correct interpretation and sending a copy of the electronic fetal monitor strip without having to verbally interpret it over the phone. You can use your device as a handheld Doppler, and you can use the touch screen on the phone to call a code that is specific to your unit, which would notify all the appropriate providers to attend your emergency. Unlike other hospital devices, ours is an all-in-one device with the ability to create less communication errors to providers and allows a registered nurse at the bedside to carry less equipment. It is well documented that hospital errors happen due to miscommunication. Our device will allow the obstetrician to visually interpret the fetal monitor heart rate strip if the registered nurse is having difficulty describing the interpretation herself. The framework of innovation includes many benefits to the consumer, meaning both the patient and the providers. The technology to do all of these things already exists. They just need to come together in one product. This product would help save time for the nurse. The nurse would have all she needs in one product and not have to go searching for a Doppler. Codes would be easier to call and faster to initiate, and a clear, concise report to the provider without misinterpretation of the fetal heart rate can exist. This can save lives, time, and is more efficient for the nurse. NICHD guidelines are contained within the mobile device to help interpret the fetal monitor strip. Suggestions for interventions are contained within the mobile device. And our device allows the RN to send a 20-minute fetal heart rate strip directly to the provider so that there is no confusion as to the interpretation of the fetal heart rate. A handheld Doppler is often difficult to locate on the labor and delivery unit and requires the nurse to carry more equipment with her. Our device includes a waterproof handheld Doppler on the side of the phone, allowing for intermittent auscultation of the fetal heart rate. The fetal heart rate will show on the face screen of the mobile device and records the time it was obtained until the nurse is able to record it into the medical record. The Doppler will allow for more frequent use of intermittent fetal monitoring, allowing the patient more freedom of movement as she labors. Calling a code should be fast, easy, and have all the necessary providers at the bedside as fast as possible. For our institution, we have codes such as shoulder dystocia, a stat cesarean section, a code crimson, which is when a mother is bleeding too much, a code MTP, which is massive transfusion protocol, which is essentially when a mom is bleeding out, a code pink for when a baby needs to be resuscitated, and a code blue for when the mother needs to be resuscitated. Our mobile device will allow the nurse to use a touch screen or voice command to call the correct code that has been set by your specific hospital. The correct providers will be notified of the code through their mobile device and know precisely where to attend, and an overhead announcement will be made as well. Having the correct personnel at the bedside quickly is essential in providing the best and safest care for the mother and the fetus. Our goals at EFM mobile devices are to provide convenient and cost-effective ways to have safe and healthy mothers and babies.